I've lived through the HIV epidemic, I've lived through the COVID pandemic, and now through monkeypox. And it is frightening to see the similarities in the sense that it's always the same populations that really are at a disadvantage.
Since monkeypox emerged in May, the disease has been disproportionately impacting Hispanic men. CDC data is limited, as less than 50% of cases reported their race. Nevertheless, the data indicates that there may be disparities for Hispanic Americans affected by monkeypox.
We see these ethnic disparities in HIV and in COVID and now in monkeypox affecting Hispanic and Latino populations because people don't have health insurance and they're not in routine care. So when a new threat emerges, they don't have someone they can just call and talk to about it or get an appointment, or they're not familiar with a medical office where they have gone on a regular basis like other people are, and therefore they're losing out on information.
Access to health care is not always readily available to minority groups, including Hispanic men. Health experts also point out that Hispanic communities are less likely to be insured, causing another barrier for care.
That don't have the equity in access to care, equity in getting the care in the way they need it, and in the manner that's most appropriate to them culturally and linguistically. So I'm not surprised that we're seeing this.
Additionally, much of the information on monkeypox is not available to Spanish speakers.
There was a lot of miscommunication in the early weeks. In order to get treatment for monkeypox, you had to fill out a form as a patient. The forms were only available in English until maybe 2 or 3 months into the outbreak. Now they're finally available in Spanish.
The language barrier may be causing a gap in education about the disease for Hispanic communities.
I was just reviewing some material that really is very, very good. And it's been given out to people to talk about harm reduction. Totally, very, very informative, very dense, and not in Spanish. So to get something in Spanish is difficult.
Monkeypox does not exclusively impact gay and bisexual men, though some people believe it does.
If you're looking at the predominant number of cases of monkeypox are in men who have sex with men. Not exclusively. This is not a gay disease. This is not. But the perception out there by people who can be infected or are less risk in the general population is that it is.
In order to, even get a vaccine for monkeypox, you have to talk about your sexual behavior, your same-sex behavior. You have to talk about the number of partners that you had. You have to answer some questions related to those issues. And I think that can be very intimidating for people in an environment, in a healthcare environment that's not clearly affirming of those identities of being a gay or bisexual man.
Cultural issues could also stop Hispanic men from being vaccinated against monkeypox.
So you're expecting people to go online to basically out themselves. If you're, especially from communities, Hispanic communities and communities of color, it is not something perhaps you're most comfortable doing, and you don't want to make it public. So here you are. If you want to get your vaccine, you've got to get online and let everyone know that you are at an at-risk population.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.